Hello and welcome to the Art of Being Human. We've been dealing with the menopause and I want to possibly conclude that today. I have some charts I want to show you, some diagrams I want to tell you about. And if we would ask the question, what is the menopause anyway? Well, it's definitely a change of life issue. In fact, it's called the change of life. It's definitely a phase of life, and it has to do with the reproductive hormones becoming less and less and less, where you enter into midlife and you're not producing the hormones that you once were. And at some point, you may not be producing them at all, especially for the women. And in the women, the cessation of the reproductive hormones occurs at a greater pace than it does for men, but it is possible for men and women both to have menopause symptoms, and the strength of the symptoms or the severity of the symptoms is going to depend upon exactly how fast you're losing your hormones and how fast that occurs. With men, it occurs a lot slower than it does in women. It occurs at about the same time as you have the midlife crisis, but I still consider them to be separate events, because you could have a midlife crisis without having hormonal change, or you could have hormonal change without having a midlife crisis, but usually they occur more or less together. So I'm going to start out and show you some diagrams that I've done of glands of the human body and explain through the diagrams what actually happens in the monthly cycle of the female particularly, and what happens to cause the menopause, what happens to cause pregnancy, so you can actually see. I think it's easier to understand if you see it. So I'm going to look first at these diagrams that I have drawn out for us. This is kind of my version of the human being, the human female, with the major glands and the major organs of the body. So if we can kind of get a close-up of that, that would be good. Thank you. That's good. Starting off with what's obvious here. Here you have the brain. This would be the brain stem. This goes down into being the spinal column. And this is the pituitary gland. I didn't label this, but this is a pineal gland. It's a little deeper than the pituitary, but I'm particularly interested in the pituitary gland. Then going down into the neck area, we have the thyroid gland, and we have the parathyroids. The parathyroids are about 5 or 6 little small glands that are embedded in the thyroid. Then, of course, you have the major organ, the heart, the liver. You have the 2 kidneys. On top of the kidneys, you have the adrenal glands, too. You have the pancreas. Now, naturally, they're not spaced out like this. I've drawn them like that. But you have organs under organs under organs. And then here you have the uterus. And this we're going to spend quite a bit of time with. This is the uterus. It is about the size of a pear. And these are the fallopian tubes. And these are the ovaries. And this would be the cervix right here, and this would be the vagina. So this whole area here is the reproductive area of the female. I'm going to put this down and show you some other diagrams and then get back to this one again, because it's important. I can explain the whole reproductive cycle with it. Here is the uterus. Right here, as I said, it's about the size of a pear. I've magnified it, of course. Right here is the endometrial tissue. It fills up every month, preparing to accept the fertilized egg. The fallopian tubes on each side. The whole area is the uterus. The ovaries are kind of attached to the fallopian tubes, one on each side. This is the cervix right here. And then you have the vagina. This is the whole cavity of the woman, the abdominal cavity. This is what it is. Now, what would happen is, of course, the endometrial tissue builds up every month in preparation of accepting a fertilized egg. And what the sperm do is they swim up, and when they get to this area, it takes just 1 egg and 1 sperm to produce a baby. Then it comes down, it will swim down, the fertilized egg will swim down the fallopian tubes and embed itself in the endometrium, which is ready for it, and then it'll grow into the baby. Now, one ovary on each side of the uterus, and this is important because a girl will be born with all of the eggs that she'll ever have, but they're not mature. So every month, one egg becomes mature. 1 month it'll be one ovary, and the next month it'll be the other ovary. So they switch back and forth on an alternating basis. Of course, this wouldn't explain twins. When you have fraternal twins, instead of the ovary producing one egg, it may produce two. In the case of triplets, 3. In the case of quadruplets, 4. If you're taking some kind of a drug to cause you to become pregnant, who knows how many, but it could be quite a few. Generally speaking, though, and we're using basically the rule of thumb, it's one egg on an ovary 1 month, and the other egg from an ovary on the other month, each month preparing. Now, when the egg does not get fertilized, then this endometrium sheds. It sheds and it just goes down into the, from the vagina, and that's when the individual has a period. And then the process starts all over again with the gradual buildup of the endometrium. This happens month after month after month. And so women kind of have to get used to that. Now, I have a couple of other things here I want to show you. So here is the ovum. The ovum is a very, very large cell. It's large enough that in certain situations you can see it. It would look like a little pinpoint, like a little pencil point. That's very, very tiny, of course, but it's very large as a cell because most cells cannot be individually seen, but the egg can. The sperm are much, much tinier. You cannot see them. They're swimming in fluids. They have the head. This is a sperm head, and they have the tail. And although I didn't do any measuring for this, but the tail of the sperm is 10 times, actually 10 times larger than the head. That still doesn't make it big enough to be seen, but it's a fairly long tail, and it flips back and forth and swims up to try to meet the egg. Only one sperm is going to be accepted by the ovum. The ovum is the egg cell. Only one will be accepted as a general rule. And when it gets in there, the ovum closes off. None of the other sperm are affected, and they just kind of die and fall away. Now you have an egg that's fertilized, and it has all of the things that a person needs to have to become a human being. All of the genes, everything is right there. So then that swims down and gets embedded into the endometrium of the uterus. And here again, this is the whole uterus, about the size of a pear, about the shape of a pear, with the fallopian tubes, with the ovaries, one attached to each fallopian tube, the cervix, and the vagina. And if it is impregnated, if the egg is fertilized, it will embed itself, and then the uterus will stretch. It provides food and nourishment for this egg as it starts to subdivide into a human being. And it really is quite a situation, because at the end of 4 weeks, now at the end of 4 weeks, you can't even see the ovum. I mean, you can't see any human being within it. But already the heart is beginning to form. At the end of 4 weeks, you have tissue around the area of where the heart is going to be, and it's starting to spasm a little bit. This is going to become the heart and the heartbeat. So it shows itself up early. It's interesting when we get into reproduction, and I'm going to do that later on, we'll get into exactly what's produced and when. Now, this I want to show you. This is pretty much to specs in terms of relative size, because I did all the measuring and all of that. But as I said before, the egg cell is quite large. It can actually be seen under certain circumstances as a little tiny pencil dot. The sperm, and there are millions of them, They just swim up, and one of them gets accepted. You can't see them, but one of them gets accepted, and then the egg is fertilized, and then it starts to go down into the fallopian tubes and then into the uterus from there. So if you want to consider this, consider the relative size of the sperm in terms of the relative size of the egg. The egg, and of course I've magnified it many, many, many times, but that's the only way you can see it. But you can see hundreds and hundreds of times, it's hundreds of times larger than the sperm cell. Now, if you have an ovary producing more than one egg, you're going to get multiple births. If in the case of identical twins, you have one egg and you have one sperm, and that egg splits in half. And so you have two eggs, and they're identical, and that's where your identical twins will come from. Or you can even have identical triplets, although that's kind of rare. Or a person may have actually identical twins and one or two other siblings, depending upon how many eggs were produced to begin with. So technically, it is possible for a woman to have identical twins, and then the ovary produce 2 or 3 more eggs, all fertilized, and she might have 5 children, 1 set identical twins, 3 single births, all occurring at the same time because the fertilization process occurred at the same time. It really gets to be quite fascinating, but as a rule of thumb, and we're just talking rule of thumb here, 1 egg, 1 ovary. In the next month, 1 egg, the other ovary, and back and forth. You know, I had a friend who had a lot of pain in the monthly cycle on an every other month basis. She always knew when she was ovulating. When that egg is produced, that's the ovulation process. And she always knew which ovary was doing it because there was an ovary in trouble. And she would have terrible pain on the month that that ovary ovulated, but then the next month the other ovary would ovulate and she would have no pain at all. So she was able to track it. Now, I don't know medically if they did anything for her, but I know she talked to me about it and said, you know, this is kind of driving me crazy because this next month I know is the month I'm going to have pain, but the next month I won't have any pain after that. So it can be tracked. So I wanted to show you that. Now back to this first diagram. How does all of this occur? Well, you start off with the pituitary gland. We're talking about the monthly cycle and what actually occurs here. You start with the pituitary gland. It's going to produce a hormone that's called the follicle stimulating hormone, which it does every month. And this hormone is going to trigger the ovaries to produce estrogen and an egg. 1 egg 1 month and another egg the other month, as I mentioned before, on an alternating basis. That's the general rule of thumb. So what the hormone from the pituitary does, and of course the pituitary, as you know, is a master gland of the body. It kind of controls all of the other glands. It produces the follicle stimulating hormone, or FSH. In a normal person, a young person, these are going to produce the eggs and they're going to produce estrogen, and then there's a possibility of pregnancy. Now, if there is a pregnancy, then it lodges, the eggs, the fertilized egg swims around and lodges itself in the endometrium, which takes care of it, and then it stretches. And then you can see as the baby gets larger and larger, the abdomen of the woman gets larger and larger. If she does not have a baby, if there's no impregnation occurred, then all of this sheds in the monthly period. And that's what happens month after month after month. Now, what happens is that I'm going to put this down now, and I want to put these charts up to explain this cycle. Maybe it'll be more understandable. Every month, there's a complicated cycle in the female reproductive system. The estrogen hormones, remember we're starting off really with the pituitary, but the estrogen hormones cause the uterus to thicken. That's the endometrium inside of the uterus. The uterus is responding to accept the fertilized egg. The ovary produces 1 egg a month. There are 2 ovaries, one on 1 month, one on the other month. The egg is fertilized by a sperm and it settles in the uterus and grows. If it doesn't fertilize, then the whole thing sheds. That's the period, and then you start all over again. So what happens during the menopause, my purpose in doing all of this is to build up so you'll understand better what the menopause is. In the menopause, there is a stopping of the monthly female cycle, or at least the slowing down of it. The ovaries slow or stop in the production of estrogen, which is the female reproductive hormone. You also have progesterone. There's more than one hormone involved, but the symptoms come from the lack of estrogen. And the females produces estrogen and progesterone. The menopause occurs usually between 45 and 55 years of age, but that's very variable. Some women start as early with perimenopause, which is a period before the main menopause. Some women start in their 30s, but some women don't start until their 60s. And it's also based a lot upon what's happening in a person's life. I know a woman who went through menopause, and her husband died unexpectedly, and she started her monthly cycle all over again. It was such a shock to the system. And then she went another 3 years with normal cycle until finally she went into the menopause permanently. But this is the usual age. The ovaries stop producing the eggs, and there's less estrogen, and there is increased gonadotropin and the male hormones, because women do have a little bit of the male hormone, just like men have a little bit of the female hormone. Now, the symptoms of menopause, if it occurs gradually enough, if the change occurs gradually enough, the body may well need to adapt, would be able to adapt and not have too much wrong. But if it happens more quickly, then you can have a lot of symptoms that are very uncomfortable. 70% of women have hot flashes and night sweats. They wake up and they're soaking wet because of night sweats. And the last 5 years of the menopause can be severe. There's vaginal dryness. There's dryness caused by the skin thinning because the natural oils diminish. The vagina starts to shrink a little. The bladder and the urethra change. The body and the scalp hair become dry and brittle, and a hair drops out more easily. That's sometimes known as menopausal thinning. When people, you see women, especially elderly women, they have less and less hair. That's called a lot of times menopausal thinning. Then you have your psychological symptoms. The memory's not as good. There's poor concentration, tearfulness. There's a severe anxiety, severe depression. They feel like they're just losing themselves. They feel like they want to scream when they go into a store. They have to be constantly physically active. There are some women who they just can't stop. They've got to be moving, 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 moving. That can be one of the menopause symptoms too. The vision is blurred. There's dizziness. Some women pass out. Sometimes there's sleeplessness and the person can't sleep. Also, the bones lose calcium. The osteoporosis sets in with brittle bones. The blood pressure rises. Fats in the blood increase. Atherosclerosis, which is fats in the artery, increase, giving heart trouble. You can have coronary heart disease. Doesn't that sound awful? There is an imbalance of estrogen and progesterone, which causes excessive endometrium to build up. I'm going to skip over this. People can have fibroids or polyps, endometriosis, which is really quite a bad disease, although it's treated more easily than it used to be, and I'll explain what that is. And the pituitary gland causes the ovaries to try to get the ovaries to produce the estrogen. If they can't do it, then you get an excess of the follicle-stimulating hormone, no estrogen when you need it, and the severe symptoms come from that. So if the ovary can't produce an egg, or the ovaries can't produce estrogen, the pituitary will continue to produce the follicle-stimulating hormone, building it up and causing menopause symptoms. Now, I don't want you to think that this is such a horrible process. In some women, it is a horrible process, but not in everybody. Not everybody has terrible symptoms, but some people do have terrible symptoms, and they have to be treated for it. I was going to tell you a story, but I don't really have time for it, so I'm going to wait till next time. We don't have much more to go, so I'm going to continue with this and we'll finish it next time. So we'll close it here. Please join me next time.